Have you ever felt a burning sensation in your stomach and thought it was just heartburn? You're not alone. I remember one of my patients, George, who came to me complaining about discomfort in his stomach. He dismissed it as just something that happens with age, but after several months, the pain intensified, and it turned out he had a severe stomach ulcer. It was only then that he realized how serious it was. Ulcers aren't just minor irritations, they are actual wounds in the lining of your stomach, small intestine, or esophagus. What starts as a mild burning feeling can quickly develop into something much more dangerous. Today, we're going to explore the causes, symptoms, and treatments of ulcers so you can understand how serious this condition is before it silently progresses into something far worse. What causes ulcers? I'll never forget a conversation I had with Linda, a patient in her mid-60s who had been struggling with persistent stomach discomfort for a long time. Like many people, she chalked it up to stress and poor diet. But the truth is, ulcers develop when the protective lining of the stomach or small intestine erodes, allowing stomach acid to damage the underlying tissue. Your stomach naturally produces hydrochloric acid to help digest food, and it also produces mucus to protect its own lining. But when this balance is disrupted, either by increased acid production or a weakened mucosal barrier, ulcers begin to form. One of the most common causes of this imbalance is a bacterium called Helicobacter pylori, H. pylori. This infection often goes unnoticed for years. In Linda's case, she had been carrying H. pylori without even knowing it, which gradually weakened the lining of her stomach and led to ulcer formation. Another significant cause of ulcers is the overuse of NSAIDs, non-steroidal anti-inflammatory drugs like ibuprofen and aspirin. These medications reduce the body's production of prostaglandins, compounds that protect the stomach lining. Linda had been using ibuprofen frequently for arthritis pain, which put her at a higher risk for developing an ulcer. Stress doesn't directly cause ulcers, but it can aggravate them by altering digestion and acid production. Additionally, lifestyle factors like smoking, alcohol, and poor diet can further impair the stomach's ability to heal itself, making ulcers worse over time. Signs and symptoms of ulcers. You might not feel the pain of an ulcer immediately. In fact, many ulcers can go undetected for months or even years. One of my patients, Richard, was using over-the-counter antacids to relieve what he thought was indigestion. But when the pain didn't go away, he finally came to me, and that's when we discovered an ulcer. The most common symptom of an ulcer is burning or gnawing pain in the upper abdomen. This pain is usually felt between meals or at night. Interestingly, the pain might ease temporarily after eating or taking antacids, but it always comes back, sometimes even stronger. If the ulcer is located in the duodenum, the first part of the small intestine, the pain may come a few hours after eating and may improve with food. But if it's in the stomach, eating might actually make the pain worse. Other warning signs of ulcers include bloating, frequent burping, poor appetite, and unexplained weight loss. In more severe cases, ulcers can cause nausea, vomiting, and a feeling of fullness after eating just a small amount. If the ulcer begins to bleed, things get much more serious. If you vomit something that looks like coffee grounds or have black, tarry stools, it indicates internal bleeding. This is a medical emergency that requires immediate attention. Chronic bleeding from an ulcer can also lead to iron deficiency anemia, which causes fatigue, dizziness, and pale skin.
The most frightening symptom of all is sudden, sharp abdominal pain that spreads across the belly. This could signal a perforated ulcer, meaning the ulcer has created a hole in the stomach or intestinal wall, causing stomach contents to leak into the abdominal cavity, leading to a severe infection called peritonitis. This can be fatal without immediate treatment, including surgery and antibiotics.
How are ulcers diagnosed? Diagnosing an ulcer isn't always straightforward. Many patients I've seen initially assume they're just dealing with ordinary stomach discomfort. But as we know, the symptoms can overlap with many other gastrointestinal disorders. This can lead people to self-medicate, or even worse, ignore the issue altogether until it becomes more severe. I remember a patient, Mary, who came to me after months of experiencing consistent stomach discomfort. She thought it was just a case of indigestion, but when we looked deeper, it turned out she had a significant ulcer. Early diagnosis is key. Ulcers don't always announce themselves loudly, and many go undetected for quite some time. The most accurate diagnostic tool for ulcers is an upper endoscopy, also known as esophagogastroscopy. EGD. In this procedure, a flexible tube with a camera is inserted through the mouth into the stomach and small intestine, allowing doctors to directly visualize the ulcer and take a biopsy if needed. This procedure is especially important if there's a suspicion of H. pylori infection or to rule out stomach cancer. For Mary, this was crucial, as we were able to see exactly where the ulcer was located and assess its severity. It also allowed us to test for H. pylori, the bacterial culprit often responsible for many ulcers. Without this procedure, we wouldn't have been able to make the proper treatment plan. But endoscopy isn't the only method. Non-invasive tests like the urea breath test, stool antigen test, or blood antibody test can be used to detect H. pylori, but they don't provide a clear picture of the stomach lining itself. That's why an endoscopy remains the gold standard. Imaging tests like X-rays with barium contrast can sometimes be helpful, especially in detecting large ulcers, but they are far less sensitive than endoscopy. They may miss smaller ulcers or fail to show signs of more serious damage, such as bleeding or perforation. An often overlooked aspect of diagnosing ulcers is understanding the medication history. If you're someone who frequently takes NSAIDs like ibuprofen, aspirin, or corticosteroids, it's critical that you inform your doctor. These medications can significantly increase the risk of ulcers, complicating both diagnosis and treatment. I once treated a patient, Frank, who had been taking ibuprofen for years to manage chronic joint pain. By the time he came to me, the damage from his NSAID use had already progressed into a serious ulcer. Accurate diagnosis isn't just important to treat the pain. It's essential to prevent dangerous complications like internal bleeding, infection, or perforation. If you wait too long, the ulcer could worsen and the damage could be harder to reverse. So if you've noticed any of the symptoms I've described, don't ignore them. Get checked out by a doctor as soon as possible. Early detection is your best chance at preventing serious complications and improving your health. Treatment and medical options. I vividly remember the day Linda's treatment began. After we diagnosed her ulcer caused by H. pylori, we started her on antibiotics to eliminate the bacteria and a proton pump inhibitor to reduce acid production. This allowed the ulcer to heal. PPIs, like omeprazole, are highly effective and typically prescribed for several weeks. For ulcers not caused by H. pylori, Acid-suppressing medications like H2 receptor antagonists, e.g. ranitidine, can also be used. Antacids might provide temporary relief, but they won't heal the ulcer or address the underlying cause. If the ulcer is caused by NSAIDs, stopping the medication is crucial, though this must be done under medical supervision. In some cases, other medications or protective drugs may be prescribed to manage chronic pain. While surgery is rarely required today, it may become necessary if the ulcer causes bleeding, perforation, or obstruction. In those cases, an endoscopic cauterization can stop the bleeding, but emergency surgery may be needed if the ulcer has created a hole in the stomach wall. Final warning and conclusion. I want to stress something important here. Ulcers are not minor irritations. They're open wounds that can expose you to internal bleeding, infection, and long-term organ damage. Unfortunately, many people ignore the early symptoms or self-medicate with over-the-counter drugs that mask the pain. As we've discussed, ulcers don't just go away. They can deepen, spread, and cause more damage the longer you wait. Early diagnosis and treatment are crucial in preventing serious complications. So if you've noticed any of the symptoms I've described, don't ignore them. Get checked out by a doctor as soon as possible. Remember, ulcers can kill quietly, but you have the power to stop them if you act early. Please share your experiences or questions in the comments below. I'd love to hear your thoughts and help you out. Thank you for watching, and stay safe.